muscle spindle reflex, and autonomic reflex. The example is baroreceptor reflex to control the blood pressure. Now, depending upon the developmental pattern, reflex is classified into innate reflex and conditioned reflex. Innate reflex means the muscle example of innate reflex is muscle spindle stretch reflex. Okay, conditioned reflex is salivation reflex of Pavlov's dogs. This is an example. Number of synapses according to the number of synapses that are present in the reflex can be monosynaptic or polysynaptic. Example of monosynaptic reflexes are muscle spindle stretch reflex. Another is polysynaptic reflex. Its example is all other reflexes like the plantar reflex. Okay, so here we have discussed about the classification of reflexes. According to the various bases of classification, the reflexes are classified into various types. Okay, let's see this picture. This is a reflex arc. Here we see that eyes, they receive the receptors. The receptors in the eye are rods and cones. They see something, they are able to see something with the help of these receptors. Then the sensory input comes, it is integrated in the CNS. Then through the efferent or the motor output, it gives the command to the effector organ, that is to the muscles, and then we run. Okay, if we see some danger, then we realize that we have to run, and then the contraction of the muscle occurs and we run. Okay, here in this picture, this is a transverse section of the spinal cord. What happens is we are talking about the pathway that is traveled by the reflex. So the path that is traveled by a reflex is called reflex arc. We should know what are the components of the reflex arc. The first component is the receptor. The second component is the sensory neuron. The third component is the center. It is usually central nervous system. Here it is spinal cord. Okay. So the first component is receptor. Second component is sensory nerve or afferent nerve. Third component is center. Fourth component is efferent nerve or motor nerve. And fifth component is effector organ or muscle. Okay. So this is regarding reflex arc. Now let's see. These instruments are known as percussion hammer or clinical hammer. Okay. So it is the repetition for you to revise and recall. Reflex is an involuntary motor response to a sensory threshold stimulus involving CNS. See, here a pin has pricked the skin, so the person feels pain sensation. The sensation is received by receptor, then the afferent nerve carries it through the dorsal root ganglia to the dorsal column. The sensation is going. Okay, this is the sensory nerve. This is the center. Okay, spinal cord is the center. From center, it goes to the motor neuron, that is efferent neuron, and then it goes to the muscles or effector organ. Okay, so after this, the same thing again for you to remember. Reflex arc means the path traveled by the reflex. This is receptor. This is the receptor number one. Then the sensory nerve or the afferent nerve, the center. Okay. Fourth is the efferent nerve or motor nerve, and fifth is effector organ. Okay. Again, we talk about classification of the reflex on the basis of the number of synapses that are present in the reflex arc. It can be monosynaptic reflex, bisynaptic reflex, or polysynaptic reflex. Okay, polysynaptic reflex examples are withdrawal reflexes, mainly the superficial reflexes like the plantar reflex. Okay, whereas in example of bisynaptic reflexes, inverse stretch reflex. And the example of monosynaptic reflex is stretch reflex. And this both stretch reflex and inverse stretch reflex, they both are combined. Okay. Inter intervallar with the I'm sorry, I interrupted. Reflex, the classification of reflex we were talking on the basis of number of synapses. They are monosynaptic, bisynaptic, and polysynaptic reflexes. Bisynaptic means two synapses are there in a reflex arc. Monosynaptic, one synapse in the entire reflex arc. Polysynaptic means many synapses are there in one reflex arc. Okay, so polysynaptic reflex example is withdrawal reflexes, the superficial reflexes like the plantar reflex, Stravinsky sign Johansson, that. Another is bisynaptic reflex, example is inverse stretch reflex. Monosynaptic reflex, it includes stretch reflex. Okay, and stretch reflex and inverse stretch reflex are together known as deep reflex. This is what we practice in our practicals. Okay. In the coming week, we will be discussing about the superficial reflex and deep reflex examination. Okay. So now what is let's see, what is excuse me, what is stretch reflex? The monosynaptic reflex, which is triggered by stretching of the muscle, is called stretch reflex. That's why its name is stretch reflex. And the sensory receptor in the muscle is the muscle spindle. Please remember, the receptor of the stretch reflex is muscle spindle. You must remember this. Okay. The receptor of the stretch reflex is muscle spindle, and it detects the changes in muscle length and reflexly brings about alpha motor neuron discharge. Another is inverse stretch reflex. It is a protective reflex, which is triggered by excessive rise in muscle tension. The tension detecting receptors are located in the tendons called Golgi tendon organ. That means the receptors for inverse stretch reflex are Golgi tendon organ. But the receptor for stretch reflex are muscle spindles. Stimulation of these receptors bring about a reflex inhibition of the alpha motor neurons. The inhibition is possible by the interposition of an inhibitory Golgi bottle neuron. This is an inhibitory interneuron in the reflex arc, which is bisynaptic. Okay, having two synapses. That's why inverse stretch reflex is having two synapses. Its receptor is Golgi tendon organ. Stretch reflex, it has one receptor, that's why it is called, sorry, it has one synapse, that's why it is called monosynaptic, and its receptor is muscle spindle. Withdrawal reflex is protective. It is triggered by painful stimuli. It results in flexion of the affected limb. The reflex arc is polysynaptic. It has many synapses in the reflex arc. Withdrawal reflex is associated with a crossed extensor reflex, which is important for postural regulation. Okay, let's see. This is the picture for monosynaptic reflex, and the lower one is the picture for polysynaptic reflex. And the first one, monosynaptic reflex, it has a single synapse between the afferent and the efferent neuron. Please see here, this is one synapse. Okay, stimulus is there, receptor is there, afferent nerve is there, and then you see it brings in the dorsal root ganglion, it brings in the information, and there is synapse here between this neuron and this neuron. So there is only one synapse involved, and then this is again somatic motor neuron, and going to the skeletal muscle. So this is monosynaptic reflex. What is the receptor? Receptor is the muscle spindle. Polysynaptic reflexes have two or more synapses. So let's see, stimulus is received by the receptor, then sensory neuron. Then you see there is one synapse. Then there is an interneuron, Golgi bottle neuron, or any inhibitory neuron. Interneurons are usually inhibited. So it inhibits the action. Okay. And then it is again carried by, the information is carried by motor neurons. So what happens? There is one synapse between this neuron and the interneuron, another synapse between the interneuron and the motor neuron. So there are many synapses. That's why there are more than one synapses. That's why it is known as polysynaptic reflexes. Example is plantar reflex or Babinski sign. Now we need to know the difference between deep reflexes and superficial reflexes. As the word itself tells you, deep. So deep reflexes are elicited from deep structures, mostly by stretch of the muscles. Superficial reflexes, they are elicited from superficial structures. Larger areas are involved. The receptor for muscle, the receptor for deep reflexes are muscle spindle, and the receptor for superficial reflex are scattered in skin or mucous membrane. In deep reflex are monosynaptic, whereas superficial reflex are polysynaptic. Deep reflex involves a single muscle and a joint and a single joint. Okay, remember this. Whereas superficial reflexes, they are usually polysynaptic. They involve a group of muscles or more than one joint. And deep reflexes are always centered in the spinal cord, whereas superficial reflexes have reverberatory circuits passing through cerebral cortex. Example of the deep reflex is biceps jerk, knee jerk, etc. Whereas the example of superficial reflex are plantar reflex, abdominal reflex. Okay, you can put a mark in your copies and write important because we often ask the difference between deep reflex and superficial reflex in your vivas. See, this is showing the knee jerk reflex. What happens here is this is the patellar tendon, patellar ligament is here. We strike by the clinical hammer on the patellar tendon, and then what happens? This muscle gets stretched. When it gets stretched, then knee jerk is seen. Okay, so this is the root value of this jerk is L3, L4, L3, L4, L2, L3, L4. Okay, now let's see if we are doing the reflex. If you're doing the reflex and the muscle contraction is not elicited, is not seen, then what do? We ask the subject to clench the teeth. That is one method. Another is we ask the subject to uh, hold both the hands together and interlock the fingers and pull the fingers in opposite directions. Okay, like this in the picture. I'll show you. Like this. This lady, we have asked the lady to interlock the fingers, both the hands, and then stretch them apart. Stretch them. You can see in this picture also the gentleman is doing interlocking the fingers and then doing, and the examiner is doing the knee reflex. Here, ankle reflex is being done. So this is known as the reinforcement of Jendrassic's maneuver. The subject is asked to make voluntary effort by interlocking the fingers of the hand and pulling them in opposite direction. Or this can be done, or we can ask the subject to clench the teeth. For example, if we are doing the biceps reflex or triceps reflex, then the hands will not be free to interlock the fingers, isn't it? So at that time, we ask the person to clench the teeth. Okay. So what is the mechanism of Jendrassic's maneuver or reinforcement? It helps to elicit the reflex by increasing the gamma firing. This is, we often ask in exam, why do we ask the patient to do Jendrassic's maneuver or reinforcement? The answer is increase the gamma firing. Okay, and the word Jendrassic has come in honor of Hungarian physician Erno Jendrassic. Okay, and now let's see the different kind of jerks. This deep reflex has got multiple names. One is deep reflex, another is called tendon reflex. But when you say tendon reflex, do not get confused that its receptor is in muscle spindle, not in tendon. Okay, this muscle spindle is the receptor. Another name for deep reflex is stretch reflex. Another name is monosynaptic reflex, and another name is myotatic. So how many? There are 5 names for the same reflex. Okay, let's see. This is the biceps jerk that we are doing. Its root value is C5 and C6. And do remember to do the reflex on both the sides. Both the sides means do on the right side and then on the left side and compare. Okay. This is the triceps jerk. Another jerk, triceps jerk. Root value is C6, C7. Another is this is supinator jerk. Root value is C5, C6. This is knee jerk. The root value is L2, L3, L4. For ankle jerk, the root value is S1 and S2. Ankle jerk, the picture is seen here. We strike on the Achilles tendon. Okay, and we see the muscle contraction of the calf muscles. After that, let's talk about Babinski sign. Superficial reflex or polysynaptic reflex. Okay, plantar reflex. Flexor response in plantar reflex means Babinski negative, and extensor response in plantar reflex means Babinski positive. In children who are less than 2 years of age, okay, not only infants, even children who are more than 1 year but less than 2 years, in them the pyramidal tracts, they are not well developed. Okay, so when we strike here, when we put our fingers here, then there is dorsiflexion of the greater toe and panning out of other toes. See here, there is dorsiflexion of the greater toe and panning out of other fingers. This is known as Babinski sign positive, that is extensor response. Now let's see in an adult case, when we when we strike, when we stroke the skin from the heel laterally, we go forwards and then we go medially towards the bigger toe. Then we do like this. The normal reaction is toe goes down and other fingers also go down. Okay. Do you remember walking in a muddy path, barefooted? There's chances of us falling, isn't it? When we are walking in a very chiclopath, a very slippery and muddy path with our foot, with our barefoot, then there is chance of slipping. So what is the position of the toes? The toe tries to grip, isn't it? The toe goes downwards, and other fingers, other toes also go downwards, isn't it? So same is the case. Same is the case in case of uh, Babinski negative. This is the normal one. Babinski negative is normal. This is called flexor response. Okay, but when we strike from heel, we go laterally and then we go medially. And if there is upgoing of the greater toe and planning of the other toes, that means it is Babinski sign positive or extensor plantar response, and this is abnormal. Okay, there are two conditions. There are physiological conditions where Babinski sign is positive, and there are pathological conditions also where Babinski sign is positive. So let's see the physiological conditions where Babinski sign are positive. One is children below 2 years of age, because the myelination of the pyramidal tracts is not complete. So in them, Babinski sign is positive when they are less than 2 years of age. Another is in us, in adults, when we are in deep sleep. At that time also, when we are in deep sleep, at that time also, the Babinski sign is positive. The pathological conditions where Babinski sign is positive are upper motor neuron lesion or hemiplegia, that is paralysis of one half of the body, or stroke. Okay, let's see another picture. This is a spinal reflex. There are various types. One is reciprocal inhibition, another is flexor withdrawal reflex, another is crossed extensor reflex. Okay, so when there is contraction of one group of muscles, antagonistic group of muscles are relaxed. Okay, that's how they work. When there is biceps contraction, there is relaxation of the triceps. When there is triceps contracting, there is relaxation of the biceps. Okay, then let's see stretch reflex. This is another diagram for stretch reflex. See, patellar ligament, we strike with a patellar percussion hammer or clinical hammer. Then the information is carried, okay? sensory nerves, they carry the information. Interneuron is there, then it carries information to the other side also. Okay, so this is how the information is carried. This is the main basis of stretch reflex. What happens? Let's see one by one. Uh, Number one, afferent impulses from stretch receptor to the spinal cord. Okay, when we strike with a hammer, afferent impulses they go to the spinal cord from the stretch receptor to the spinal cord. Then what happens? Then in spinal cord, efferent impulses from spinal cord, the efferent impulses goes to the efferent impulses to alpha motor neurons. These are alpha motor neurons because contraction of the stretched muscle that resists or reverses the stretch. Okay, it causes contraction of the stretched muscle that resists or reverses the stretch. Another is third one is efferent impulses to antagonistic muscles are damped. Reciprocal inhibition also occurs. Okay, so these are the points you should remember. Another is Golgi tendon reflex. In this case, what happens is when the weight becomes excessive, then there is a chance of the muscle to tear. Okay, so to prevent the muscle from tearing, the tendon, Golgi tendon organ, this receptor gets stimulated and muscle relaxation occurs. Okay, and the muscle doesn't rupture. That is called Golgi tendon reflex, also known as bisynaptic reflex. The reciprocal inhibition, that is, when one group of muscles are contracting, the other group of muscles are relaxing. Antagonistic muscles are relaxing. This is withdrawal reflex. Step 1 is arrival of the stimulus and activation of the receptor. The pin is here. Number 2, activation of sensory neuron through dorsal root ganglia. Information goes to the spinal cord. Okay, step 3, information processing is done in CNS. Then step 4, what happens? The activation of motor neuron occurs. Okay, and what is the, when there is activation of motor neuron, the fifth step is there is response by the effector. That is, the muscle is withdrawn. Hand is withdrawn from the pain, from the stimuli, painful stimuli. So this entire step is known as withdrawal reflex. Okay, the withdrawal reflex, same thing. There's a hot candle, okay, and when our finger reaches near, then it is withdrawn. Okay, same thing. Polysynaptic reflex. This is a withdrawal reflex has many synapses involved. See here, one synapse, another, and there will be many synapses involved also. So it is more than one synapse, so it is known as polysynaptic reflex, withdrawal reflex. Okay. After that, let's see this one, withdrawal reflex. Its importance is in maintaining the posture. For example, when we are walking barefooted and we come across a pin, our one foot touches the pin on the path, then that foot is quickly withdrawn. But at the same time, the other foot is not withdrawn. It is firmly present in the ground. Okay, this is what happens when this is flexed to protect the muscles from the injury stimuli, but the opposite leg muscles they will be extended. Okay, otherwise the posture cannot be maintained. If both the legs are flexed, then what will happen? The person will fall down, and if there are multiple pins, then what will happen? Be injured, isn't it? So this is withdrawal reflex. Now let's talk about the properties of reflex. Localization is one property, another is irradiation, delay, 0.5 millisecond delay is there, resistance of lock, summation is there, temporal and spatial summation, both of them are there. Occlusion is there. Another character is subliminal fringe. Another is inhibition, rebound phenomenon. Another is reciprocal inhibition, recruitment, after discharge, and fatigue. Okay, these are the properties of reflex. Let's talk about the picture from your textbook, Gannon. This is a textbook from Gannon. We are talking about the stretch stim. We are talking about the stretch reflex and the inverse stretch reflex. Okay. So from here, what happens is stretch stimulates the muscle spindle, which activates the 1A afferent fibers. It activates the 1A afferent fibers. See here. Okay. And then what happens? It excites the motor neuron. Okay, the motor neuron gets excited. It also stimulates the Golgi tendon organ, okay, which activates the 1B. When Golgi tendon organ is activated, the 1B fiber from the Golgi tendon carries information, and that information excites the interneuron, and this interneuron is inhibitory in nature. Okay. It releases inhibitory mediator known as lysine. Lysine is an inhibitory neurotransmitter. With strong stretch, the resulting hyperpolarization of the motor neuron is so great that it stops discharging. Okay. And then there is no more contraction of the muscle, there is relaxation of the muscle. This is a picture of Golgi tendon organ. This can come in your spotters. Okay. Now let's talk about this is the knee reflex, knee jerk. Already know we discussed about it, isn't it? Now let's see about the reflex arc, Golgi tendon organ. The receptor is in the Golgi tendon organ. This is different from stretch reflex. This is bisynaptic reflex, okay, or inverse stretch reflex. Can you see? This is for reciprocal innervation, one muscle